All right. So in response to this question about misdiagnosis, the possibility of misdiagnosis or of altered diagnosis, or really having it be that there are psychiatric conditions and then non-psychiatric mental conditions that might really actually be masking themselves as psychiatric conditions. It really points to the same thing I said before, which is that psychiatry is based on very vague notions of what normalcy is. So even in the world of a learning disability, there's some real question of whether that's a disability. It's just really how you learn. And what happened in the case that you had previously described offline is that people heard buzzwords. Somewhere along the line, the patient said something about racing thoughts or spending too much money or being irritable or being too angry or something like that. And those clinicians have been taught that when they hear those words, ding, bipolar disorder. And then you get bipolar disorder. And the unfortunate thing about getting bipolar disorder or any condition is that once you accept that as your diagnosis or your personhood or your entire presence, then you live into, I have bipolar disorder. Once the patient has that, they then get to say, or they have to say, or they unfortunately say something like, I have bipolar disorder. But then every time that they're irritable or they spend too much money or they become hyper-religious or hypersexual or something like that, which looks like bipolar symptoms, then they get to say, see, that's not me. That's not me. That's my bipolar disorder acting up again. And it takes away from the accountability that they have in their life. And we all like to relinquish accountability and responsibility for our life because after all, life is hard. You make mistakes. I've made a couple mistakes already today. It's early in the day, and I've got a few of them in the books for sure. So this is an opportunity to really look at, in the concept of misdiagnosis, I would say that each diagnosis is a misdiagnosis. Every diagnosis is a misdiagnosis. And it really comes from the beholder. Diagnoses come from if I call myself a diagnostician, and as an MD, I'm a premier diagnostician, apparently. If I call myself that, I am only defining you by what I see, not by any hardcore truths. Given the world that I've grown up in or the world that I've designed my life in, I get to define you based on whatever spits out of my mouth. If I want to say, you don't have bipolar disorder, you got Asperger's syndrome, then all of a sudden I have just altered the course of your life by one thing that I said. You're like, wow, cool. I got Asperger's syndrome. Dustin Hoffman had that in a movie. I want that too. Or I got ADHD. That's awesome. Now I get to take Adderall or whatever your gig is. But a doctor carries around so much weight in the definition of what he sees as a diagnosis. So in your case, it sounded, the case that you ran by me offline, it sounds like we had 3 therapists. They heard whatever buzzword they heard. He tricked the trigger in 3 people. You said something you didn't even know that you said that had them go, oh, racing thoughts. Oh, bipolar disorder. Oh, difficulty sleeping and irritability. Oh, bipolar disorder. And more than likely, by the way, of the symptoms I just named, I'm sure I'm right.
Absolutely. You are 110. It's hilarious and scary, but
I've been in this field a long time, and what I'm saying makes a lot of sense. We're really just tripping triggers of the listener as announced by those who support the notion of a diagnosis existing. Mostly those are the treaters and, in fact, the manufacturers of the treatment, who then create a diagnosis based on the buzzwords. Then once you accept that as your diagnosis and you tell others that you have that diagnosis, now you really are that diagnosis, because I call myself an elephant and you agree that I'm an elephant, then sure enough, I'm telling you I am an elephant.
Gotcha.
That's the way that is. If I call myself an elephant and everyone around me says, that much is an elephant, we're done.
That's the accepted reality.
That's just the reality, not just accepted reality.
It's the reality.
That's reality.
Yeah.
And in that, I get to then be bipolar or an elephant.
Gotcha.
But what if, and this is where it really starts getting complicated, the treatments themselves actually cause the symptoms that they're marketed to treat? Actually, no kidding, physiologically cause the symptoms that they're marketed to treat. Now we got a whole new level of complication. So if, in fact, I give you a treatment and it gives you a little blip of comfort and then causes irritability, insomnia, hyperspending, hyperreligiosity, hypersexuality, feeling dangerous or something like that, if that happens to be as a result of the treatment, you'll think that's your condition and that you need more treatment. But in fact, it's maybe throwing gasoline on a fire as a way of dousing it. If you remember, if you've ever been smart enough to throw gasoline on a fire as a way of dousing it, because I have, you'll remember that initially there's a sense of dousing for a second. Right. You spray the Ronson on and it's, oh, good. And it's, oh, not so good. For a moment, the fire flames go down and a swoosh. That's really what's going on in mental illness as well, is that it's possible that more than possible, but I'm not going to go on the record saying that it's entirely certain that the treatments themselves, the medications themselves actually physiologically cause the symptoms that they're marketed to treat, which perpetuate the concept of the condition anyways. And now, instead of having what you thought you had for the reason you came to the doctor, you have what you have because you went to a doctor who's now treating you and giving you the symptoms that you now have to support the condition to go to that doctor.